Hello, everyone. My name is Catherine Grant, and I'm a communications coordinator at the Center for Celiac Research and Treatment at Mass General Hospital for Children. The COVID pandemic has affected people around the globe, and many individuals have been impacted, either directly or indirectly, by this virus. And not only are people dealing with the physical consequences of contracting the virus, but also with all of the fears and the unknowns that surround COVID 19. So, when the physical consequences of COVID 19 infection are combined with fears around finances and work, childcare, and more, the ongoing pandemic actually has the potential to cause a ripple of negative mental health outcomes. So, here with us to talk about today's topic of stress and celiac disease, we have one of our clinicians, Dr. Mark Salvatore, who treats pediatric and adult patients with celiac disease and gluten related disorders. He also happens to be the clinical director of the Pediatric Mind Body Medicine program at MGHFC and an instructor at Harvard Medical School. Hi, Mark.
Hello.
I want to start off by just asking you to kind of explain what mind body medicine is for anybody who might not be familiar with this field.
Okay. Mind-body medicine focuses on the power of the interconnectedness of the brain, mind, and body in order to promote self-awareness, self-care, and ultimately better health. And to show you the power of this interconnectedness, Catherine, I want you to take your hand, hold
Okay.
it up. I want you to squeeze it nice and tight. Keep squeezing, keep squeezing. Now, notice your breath. Are you holding your breath?
Yes.
Yes, of course. Now, what I would like you to do is while trying to hold your hand nice and tight, take a deep breath into your belly and a gentle exhale. One more deep breath in. Exhale out. Did you feel your hand relax?
Yes.
Yeah,
Oh,
you can let go.
okay.
So when your muscles are contracted, your body is communicating to your brain that you are in danger. So then the brain sends down to the body signals to increase your heart rate, increase your blood pressure, increase your respiratory rate, or to hold your breath, right? And then what we did was consciously chose to override that by taking a deep breath in and out. And what that did is signal to our body that we are safe, and hence your muscles relax. Perfect example of the interconnectedness of the brain and the body.
How did you personally become interested in mind body medicine and really start to incorporate it into your practice?
I've always been interested in psychology, and while in medical school, I was strongly considering becoming a psychiatrist, but instead chose the field of pediatrics and ultimately the field of pediatric gastroenterology. And when I became an attending, I saw many of my patients suffer from stress-induced illnesses and just became really interested in trying to find strategies to help them mitigate their symptoms without using medicine. In fact, using their body as their own form of medicine.
We'll touch on some of those strategies that you recommend in, a few minutes, but first, can you kind of tell us more about how negative emotions in the body, like stress and anxiety and, the constant worry that a lot of us are experiencing right now, how do those manifest with real symptoms and conditions?
So first, I'd like to say that we define stress as any tax on the body. There's positive stress like getting married, and then there's the more familiar negative stress like work-related stress or illness. So stress is not necessarily bad for the body. It's just that when stress overwhelms the body's ability to cope, which we term resiliency, the body and the mind suffer. And they suffer in a myriad of ways. For example, chronic headaches, chronic abdominal pain, nausea, diarrhea, hypertension. These are just a few of examples of the way the body suffers when it's under chronic stress.
And that's interesting that you point out that there can be positive forms of stress. I think that's something that a lot of us forget. Um,
Yeah.
And, I'm sure that some people might be wondering if the mind is kind of causing or worsening these symptoms, does that still mean that these symptoms are real?
Of course. Um, I really get upset when people say it's all in your head. It's not all in your head, and it's not all in your body. It's in both. right? That's why we have a neck. It connects our brain to our body. To further illustrate this to my patients, I give them an example we can all relate to: blushing. It's a physiologic state triggered by a psychological state, and that state being embarrassment. Through millions of years of evolution, the body has been created to ensure its survival. The GI tract preceded the evolution of the mammalian brain by millions of years and possesses 10 times the number of neurons that the brain has. So it has its own intuitive knowledge, the gut instinct, if you will, and can often signal to us that we are under a lot of stress, even when our conscious mind is unaware of that.
Well, and that's interesting about gut instinct. I mean, that's fascinating to think about why we, use that term. So, on the flip side, can positive emotions actually improve your symptoms or help manage conditions?
Oh, absolutely. In our Mind Body Clinic and in our 8-week SMART program, we teach positive adaptive strategies, which mitigate and counteract the negative impact of stress and bring the mind and the body to a more homeostatic balance. And there are numerous studies that show improved clinical outcomes in various disease states, such as irritable bowel syndrome, fertility, and hypertension, just to mention a few.
As a clinician at the Center for Celiac Research and Treatment, you also have experience treating celiac disease and gluten-related disorders. So how does mind-body medicine help patients with celiac disease specifically?
So there haven't been any specific studies on mind-body medicine interventions in patients with celiac disease, but there have been studies on mind-body medicine interventions in other autoimmune disease, the classic example being inflammatory bowel disease. And that data clearly showed that it decreased the frequency and severity of IBD flares. So the assumption is that if it's helpful in one autoimmune disease, it may be helpful in another autoimmune disease.
Could you give us some examples of strategies you use to help your patients manage stress and improve health outcomes?
Sure. When a patient comes to the Mind Body Medicine Clinic, the first thing I teach them about is the relaxation response, which is the antidote to the stress response. And the most basic way to elicit the relaxation response is through meditation. So I teach a myriad of meditative practices, and I encourage my patients to meditate for 15 to 20 minutes every day. I also discuss the benefits of moderate, vigorous exercise, 150 minutes a week. I also discuss the importance of sleep hygiene, of ensuring 8 to 10 hours a night of restorative sleep, because sleep is the best meditation. And I do some nutritional counseling.
Those are great. And, 10 to 15 minutes a day, it might be a while if you're not used to that type of practice, but it's not too much time, really.
No, I started with 1 minute a day and built up to about 20.
Dr. Salvatore, are there any non-commercial websites or resources that you recommend for people to visit to learn more?
Yes, I would recommend starting off with the Benson Henry Institute for Mind Body Medicine. Their website is a great resource for all things mind body medicine.
How do patients participate in this pediatric mind-body medicine program at MGHFC? How do they get started? What are some good ways for people with GI disorders to kind of start with these practices?
Anyone can self-refer to the Pediatric Mind Body Medicine Clinic. They would just call 617-726-8705 and request an appointment. We have appointments every Monday. The other way to access a referral would be through the Massachusetts General Hospital for Children website and the department page for pediatric gastroenterology. You will see the program there, and you can just, there's a hyperlink where you can do a referral that way.
That's great. And I just want to let everybody know who's watching this that we're going to actually link the resources at the end of this presentation. So they should all be easy to find, everything that Dr. Salvatore has mentioned. And I think that was our last question for you. So I just wanted to say thank you for all of your help and for filming this with us. And you've been really great.
Thank you.